Now, the one area on here I think is interesting to look at is all the way down with the green circle, which is that 2/3 of U.S. adults say I'm relying on home remedies and over-the-counter drugs instead of seeing the doctor. So there's more and more of this doing it myself at home. And Meredith's data spoke to people who are uninsured, seeking counsel online. We're seeing more and more of the self-service aspect of health. And she talked about self-service being tied perhaps more to masculine behavior, but I think a lot of women can do that too. And this is one area I know a lot of women participate in, which is coupons. And I certainly do, even though the government would tell you I'm in the higher socioeconomic stratum. But I think in the recession we saw increasing numbers of people who don't necessarily drive used cars in Walmarts, clipping coupons and buying store brands, which affluent people never really did before when they felt richer. What we found, and what we have found in the last couple of years, is people consulting publications like Consumer Reports' Best Buy Drugs to look at what's the generic like for my migraine headaches versus the prescribed drug. And you'd be surprised a couple years ago when I went to visit a migraine brand team in a company that I will not name, but it's one of N, who had a migraine drug, or has a migraine drug, that they weren't even aware that their drug was being talked about in Consumer Reports' Best Buy Drugs. So, I mean, this is a powerful thing where consumers are well ahead of industry in some of these areas. Most people are using coupons now, you might be interested to know, and more people are buying store brands and generics. And you know, Walmart kicked off the $4 refill campaign for a 30-day supply of a generic. All the pharmacies now do that. So people are finding value in these transparent ways. And transparency is another key of this consumer in the recession, looking for reviews of quality and price so that they can do their own value calculation on what they're about to purchase or consume. So you all do these things like I do. These are brands that I DIY with. I just had to return a box back to Zappos. My girlfriends in the audience know what I'm talking about. A few pair of boots that didn't fit, all went back, free shipping to and from me, and just drop it off at the UPS store. But these companies make it easy for me to DIY parts of my life that I don't have time to do at a bricks and mortar environment. And these organizations, and this is just the tip of the iceberg of the kind of organizations people use, including myself, to manage our health. I use the Mayo Clinic meditation app when I'm traveling, so I don't have to light a candle in a hotel room, which hotels don't like me to do anymore. I use Microsoft Health Vault and the Withing scale on the bottom. And I just wrote about the Mayo Clinic at the Mall, which is down on the bottom left, which is a new storefront at the Mall of America, which has 40 million visitors a year. And why does Mayo Clinic, this great branded health entity, have a storefront at Mayo Clinic at the mall? Because 40 million people walk through Mall of America every year. And they are competing, whether they like it or not, with health systems up and down the Rochester and Minneapolis and St. Paul corridor and want global recognition. And so interestingly enough, they will be opening a retail clinic in a couple weeks there as well, in addition to this storefront, which has health kiosks and interesting other self-help health services. So anyway, this just gives you the idea that, yes, people are already DIYing health, even though they might not even think about it that way. This is real life. So people are engaging in a lot of different ways. These data come from the Dell survey, and you're thinking, Dell, why the heck are they looking at health behaviors online and electronically? It's because they sell a lot of computers, and they sell a lot of computers to hospitals and doctors, and of course homes. So they want to know, how are these things being used for health? And I grabbed just a few line items from what was a 30 item question. These all have to do with electronic engagement, just so you can see, looking at the bottom, and this is data very similar to Susanna Fox's at the Pews and Meredith's from Manhattan Research. About 3/4 of people use things like WebMD to understand health issues, going all the way up to a number that really surprised me, which I'm not sure I believe, but it's Dell's number, and that's that 31% of people said they share information electronically with their physician or hospital. Now that might be e-prescribing kinds of things, meetings or online appointments, but it seems a little high to me. Anyway, though, these were Dell's data, and I think the point here, not worrying about how accurate the data are that they show that people are engaging and want to engage in things online. What patients want, Dell asks, in the future are things like this. And the top line item will please Farzad and Lygia from ONC, who will be at Health 2.0 on the patients panel I'm running next week in San Francisco. And that is that 61% of American adults say, I want access to my PHR through a portal or a private website. And that shows this pent-up demand for my own data, my own numbers that exist in these paper or siloed areas that I haven't had access to before. So people clearly are looking for this connected health experience to DIY health the way they're DIYing other aspects of their life. Now here is something that really blew my mind from Intuit. Now Intuit are the people who brought you Quicken, and Intuit offers Quicken Health, which helps you manage your HSA, FSA, your financial services in healthcare online. 3/4 of people said to Intuit earlier this year, I want online access to my doctor. And this crossed generations, not just Gen X and Gen Y, but almost 2/3 of baby boomers said, I want online access to my doctors, and men and women. Now here's the very interesting thing, which talks about the consumerization of health in America. Half of people said I would consider switching my doctor if he didn't give me online access to a variety of things. I would walk. Now not that everybody would. I'm somebody who did, because I couldn't be the shoemaker's child with no shoes once doctors around the Philadelphia suburbs started using EHRs, and I'm happy I found a really enlightened doc by doing that. But this I thought was very interesting. Now only 29% of baby boomers said they'd do this, but still 29% said that. That's almost 1 in 3 patients a physician could potentially lose to a guy down the street or a female doctor down the street who has an EHR. Now, this may be moot in the next year as more doctors adopt EHRs, but the question will be how many of these doctors use them, as the question was asked at this table next to Doug. I don't know your name, but you asked the question about meaningful use. And that gets to this. Are patients going to push meaningful use? Will people ask for their records? And there is just begun to be from ONC a consumer-facing campaign online, on TV, on radio, in magazines to educate the American public on the PHR, EHR. What is HIT? You can go to healthit.gov to see some of the videos and ads that talk to that. But you better believe the government, who is putting billions behind this effort, is now going to promote the effort to consumers to ask their doctor to either save their record on a flash drive, to open up the portal online, or to email a PDF. And all of those media are considered digital copies under meaningful use. Just doesn't have to be online. It could be a PDF emailed, or it could be use of a portal. What's also encouraging is that I'm just going to point to the purple number here. Half of people in the Intuit Quicken Health survey said, I would use the portal to ask care-related questions. So not just find out if the payment was covered by my health insurance company, what was my copay, can I make an appointment, but care questions like, I'm not sure I'm using the right level of insulin right now, doctor. I'm feeling dizzy, blah, blah, blah. So this is important. That's what we think about with connected health, not just connected health administration, health finance, but real health. Meredith's data from Manhattan Research told us a couple years ago, a really important data point, that over 1/3 of US adults were using social media for health, reading blogs, wikis, not necessarily all writing on blogs and wikis, but consuming them, using user-generated media. That 1 in 3 number I think was very important. I don't know if it's higher in this. How much higher can we know? We don't know yet, but it's higher than 1 in 3. In this area, which in a paper I wrote a couple years ago, which was called The Wisdom of Patients for California Healthcare Foundation, we talked about how people come together in patients like me and other social networks to work together and cure together, as in Alex Carmichael's organization as well. Got a shout out for her on here, and MedHelp and others, to crowdsource cures and support each other. And this is hard clinical stuff. This isn't just easy stuff. ACOR which Dave mentioned earlier, a lifesaver for him, is an important source people go to. Again, N equals 1 too many. And we're seeing this trend happening in healthcare. And then more and more people who are self-tracking, sharing what they're doing online. I will confess, my Withing scale is not tweeted, and it never will be. But it still helps me on my iPhone and my portal. Another issue of N1 to many and the power of patience I want to raise, and that's something Dr. Andrew Weil talked about earlier this year. And this has been a subject that's been really hard for clinical researchers and hard scientists to get their arms around. And that is that the double-blind clinical trial leaves something out, and that is patient preferences. How do people feel on the drug? Not just side effects and toileting habit. I have toilets on the brain today. I don't know, drinking a lot of tea. But my perceptions of the drug, do I want to take it orally? Do I want to patch? How do I want to consume this drug? How do I feel? And so Dr. Weil says we have to consider patient preferences alongside what we learned from the hard clinical trials, the double-blind studies. And we are now at a point in science research history where companies are looking to places like Patients Like Me and Cure Together and saying there is some gold there. What is it? And how do we marry patient preferences with the hard science? Because all of this works. We know about placebo effects and people's spiritual lives and really helping people get well. I saw that with my own mother, long story, but that's part of my story that's on my blog. But you know people's spiritual lives impact their health as well, although we can't prove a lot of that. But we can see it anecdotally. So I talked a lot about the go-go world of connected health and how high I am on it and how I see promise on it for bending the cost curve and getting ourselves more involved in our own health. But let's talk about some of the sobering issues and barriers to getting to this nirvana, because we as health professionals, public health people, wherever we are all stakeholders in this large community. And I see these barriers coming in three kinds of types. There are structural health system barriers. People's access to doctors, access to primary care will be a big question in the next few years as more uninsured people come into the health system. There are patient barriers, like I just don't want to health engage, I don't feel like it, or I don't believe in medicine, etc. And there are provider barriers, doctors who aren't reimbursed for seeing patients, for spending extra time, for emailing. I'll talk about a few of them. First, in terms of patient engagement, who is self-tracking? Well, Susanna Fox tells us there are only 15% of U.S. internet users who have tracked exercise, diet, or weight. This was from earlier this year. 15% isn't zero, but it's not 50. So we've got a ways to go on that. Women more likely to track. These are women internet users. What's interesting is the fourth bullet, and this is something that we talk about in health engagement at Edelman and in other places I go, which is this issue of life moments. Once you are diagnosed with something, you become very engaged, or often become very engaged. It becomes a life moment of change, a light bulb moment, like Oprah would say. Also, life moments don't have to be about diagnosis. They could be, I got a divorce, I got married, my father died, my child died, my friend was diagnosed. One of these life moments often drives people to engage in health in a variety of ways. And that moment of truth in the bull ring kind of thing, and think back to my Hemingway, studies in high school. When you're in the bull ring facing the bull, things happen. You go through changes, and that's something to think about in terms of health engagement, because it's not just about you being diagnosed. It's about the people around you. Think about the book Connections, Chris Dawkins, very important concept there. So the new American Idol, people sitting around, not engaging. And this is very true in the health barometer at Edelman last year. At least 20% of people were called health disempowered. People who were flummoxed by the health system, confused, where do I go, what do I do? So we know it's at least 1 in 5. It's probably a lot more than that. There are barriers to health engagements that employers are wrestling with. Those of us in the room lucky enough to have an employer who actually buys us health insurance or buys part of health insurance don't know how to use it. very well. There's health plan literacy. The bottom line here is 29% of employers said, my employees lack interest in health engagement, in taking responsibility. And this is something I'm sure that was discussed in either the body media session or Fran Melmed's session earlier this morning downstairs. But this issue of how do employers, who are again spending hard dollars on health insurance, going to see greater engagement, and they are developing health plans, value-based health plans, thinking about the concepts in this book, Nudge, which is a very important book if you're interested in behavior change. How do you create incentives that move people to not just, in this book talks about donate organs and contribute to the United Way, but do the right thing for their health. And the nudge is a really important concept to think about when you're thinking about health plan design. Health literacy, another issue that I'm very keen on, because we're not just talking about literacy, ability to read at an N grade level. We're talking about people leaving the doctor's office knowing what the prescription pad really says, knowing how to take the medication, orally or through the ear in the case of a pediatric medication. And you would be surprised to know how many young moms bringing lots of kids into the exam room in the back leave thinking an oral med was supposed to go through the ear for an ear infection. Don't ask me, it's real. Ask any pediatrician and she will tell you. Sarah had a drawing earlier on what organizations look like in complexity. Well, this is one drawing that you can dig up from the Atlantic on what the U.S. health system looks like. This was in the Atlantic a couple years ago. I remember when Clinton health reform came into Congress, and Senator Specter, our senator from Pennsylvania at the time, had this big drawing, and he said, this is what Clinton healthcare will look like. And it was all this labyrinthine snake-isms, looked like a Rube Goldberg machine. That's what it looks like today anyway. So this is a hard thing to get your arms around. That's why we have new healthcare concierge companies that very affluent companies provide their employees and others. But I mean, this is a hard system to navigate in the US. And Celia, welcome to our world. This system sucks if you get sick. So don't get sick while you're here. All right, stay healthy while you're here. Another issue near and dear to a lot of our hearts is the last mile of broadband. There was an FCC broadband report published a couple years ago with a huge chapter on broadband's impact on health. Broadband to a community generally means people have more access to information. Doctors, hospitals have more access to that information. Broadband is an enabler for healthy communities, and we need to see that last mile funded and built around the country. And Susanna Fox's data will tell you that householders with disabilities have less access to broadband than people without disabilities. So this is really an important concept to get your arms around. Another issue that is important to think about, which I wrote about in a paper called The Connected Patient earlier this year, was about who owns my data if I have a defibrillator implanted in me. This was the case of a patient, an e-patient, wonderful guy called Hugo Campos, based in the Bay Area. You may know him. I think he's Hugo OC on Twitter, and I met him, interviewed him for this paper, and he's become a valuable colleague to me. He is a young man diagnosed with heart problems, and he has an ICD from Medtronic, who he's called out publicly, who at the time would not grant him access to the data in a patient-friendly format. The way it comes out, his doctor can read, but he can't. So he created a group of other ICD-wearing patients who have come together to dialogue with Medtronic on how to make this happen. So change can happen when patients come together. And finally, I think what's interesting about patients and physicians is sometimes we don't want to look at the same data. The doctor wants to see different things than we do. So if you look at the case of blood sugar, one of the biggest distances on the chart, there's a big gap between doctors wanting to see blood sugar numbers and patients who need to see blood sugar numbers not wanting to see blood sugar numbers. So how do we, again, engage people, motivate people, nudge people to want to know their numbers? Because as Amy Tendrich's book on knowing your numbers as a diabetic, and she's one of the early e-patients as well on Diabetes Mind, she taught us a couple years ago, knowing your numbers really empowers you. So ultimately, I'm going to the Todd Park section of the presentation. We're looking for data liquidity. And I don't know if anybody used the phrase data liquidity. Did he say that earlier? I was late. So we're looking for right data to the right person at the right time. And as data is in all these silos, we don't have data liquidity. We have data lockboxes, and we need it to flow. Flowing is good. So as Todd would say, the end game here is data liberation. And he says it just like that. Or if he didn't today, he usually does. So this is just an example of an app on a phone that if you're in the grocery store and you're on Lipitor and you're ready to buy the orange juice, the Tropicana, and there you are, your app comes and you scan it on your phone and it says, you can't buy the orange juice, or the grapefruit juice. It'll counteract your Lipitor. So then you reach for the cranberry juice or whatever. So these are the kinds of things that can help people in their daily lives, another kind of very practical connected health. So what do I want you to take away? Think like the economists that you all are at the kitchen table, and that is that this microeconomy of health really is driving a lot of us and more people to do it themselves in health. Dave DeBronkart talked about that today. Sarah brought up the economy in her slides earlier. You really can't talk about health without talking about the economy. We know Medicare in particular is the long-term driver of the deficit in this country. And I'm not talking from any political platform right now, Republican, Democrat, or independent. But the fact of the matter is Medicare is breaking us if we don't re-engineer it, reimagine it, and really do this connected health thing to the home and via mobile, which will lower costs. And let hospitals like Ed Bennett's and doctors in their offices do what they're meant to do, take care of really sick people and be part of a community, of a health community and accountable care community. We are seeing health financing models moving toward that now. Bundled payments, value-based plans, new ways of paying for health care that are not encounter-based, that don't pay by the visit. If the doctor's being paid by the visit, he or she is not going to take care of your whole health. If they're paid for the whole episode of diabetes, a condition, or the value of asthma in kids to keep kids out of the emergency room, that kid will get armed with a mobile phone through Medicaid, and he or she will be reminded every morning, use your inhaler, and they'll play a little game that shows they use the inhaler, they'll tick it off, and they won't show up in the ER. So we're seeing gamification of healthcare, all of this through bundling payments that provides incentives to doctors, hospitals, health providers to group together where people live, work, play, and pray, which is what our Surgeon General says healthcare really should be. Healthcare is not just in the doctor's office, with all due respect to my friend Kent Bottles, the doctor in the room, and he agrees with me on this, I think. Healthcare is where we live, play, work, and pray. It's where we want it to be. So we talked about the hurdles of connected health. Sarah Hollebeck talked about design, the Design Diabetes Challenge, and what's important there is the word design, because so much of this stuff is out there. Technology is not the problem. The problem is it ain't fun to use, it ain't pretty to use, and it's not engaging. So we ask ourselves, how would Steve Jobs do it? How would Disney do it? How would Procter & Gamble do it? How would Nintendo do it? Whatever the company vendor is, that is what your users like to deal with. You know, think about it. She talked about Zynga, Farmville. This is where people are now. We really have to think about how to get people to use this stuff, because just designing it isn't good enough. Just building it isn't good enough. And finally, I'll come all the way back to Lance and Paul, who are at the NCD Forum at the UN today, about NCDs, because I'll repeat what our Surgeon General says. It's so important. Health is where we live, play, work, and pray. And once we get into a distributed kind of health and healthcare in a community where food systems are seen as part of health, transportation, urban planning, schools, the workplace, and we see this proliferation of worksite clinics because more employers understand the value of caring for patients at work, people and patients at work. We can create programs at all these touch points where people are and where people want to consume health, which is not necessarily in the doctor's office, in the ER, in the outpatient setting. And finally, what I'm talking about is not a one and done. We're really thinking, now we can think like marketers today. Think about market segmentation. What will work in this targeted population of kids for asthma or of diabetic women who feel disempowered with that labyrinthine health system? So we have to be very very clever, thinking about design, thinking about consumer products.